Hi, this is Dr. Minkoff, LifeWorks Wellness Center. Today I want to talk to you about something that we call AET, Allergy Elimination Treatment. Now, I first learned about this treatment about 23 years ago. I went to Los Angeles and I did a course by a woman named Devi Namboodrapad. And Devi was an acupuncturist and an RN, and she had tremendous numbers of food sensitivities. And she had a little baby that she was nursing, but even if she gave the little baby, who is now like 4 or 5 months old, she was starting to give the baby some carrots, and Devi was allergic to carrots. She found that when she gave her the carrots, if she even got a little bit on her skin, or she smelled a little bit of it, she would get one of these allergic reactions where she'd get a rash or she'd get asthma. I don't remember exactly what happened, but she had a real reaction to it. Okay? And she didn't know what to do about it. Now, she's an acupuncturist. And one day by accident, right after she had the exposure of this carrots or spinach, whatever it was, the thing that she was allergic to, her husband, who was also an acupuncturist, did an acupuncture treatment on her. And she noticed that the next day when she was going to feed her baby, like very carefully so the stuff didn't spill on her, and wearing a mask so she didn't smell it, that by accident it did fall on her and that she didn't get a reaction. And she started to wonder what actually occurred that I'm not now allergic to it when I was so allergic to it before. And she then worked out a system where you could use the principles of acupuncture, but not having to use needles, where you could actually desensitize someone to something that they were sensitive or allergic to. So I got very interested at that time, and I went out and I did the course that she did for doctors and health professionals. And at the time when I went out there, I was allergic to eggs. If I would eat an egg, I would get a rash on my face and I would get a stomachache. And I could avoid eggs for a few months, and then if I ate eggs again, I got the same reaction. So I'm at the course, and we're drilling with each other. The doctors that were there, once we learned how to do it, I would get a treatment, and then I would do a treatment on somebody else. So I said, I want to get treated to eggs because I actually want to see if this really works or is just this another thing that doesn't work. So I got treated to eggs. Now that was a Friday afternoon, and the course was done on Saturday night, and one of the principles of this thing is that once you've been treated for something, you have to avoid it for 25 hours. So no exposure to eggs for 25 hours. So after the treatment on Friday, I didn't have any eggs for dinner, I didn't have any eggs for breakfast, I didn't have any eggs for lunch. And then the course was over and a group of us were going to go have dinner somewhere, and everybody was trying to see where we should go. And I said, I want to go someplace where I can get some eggs, because it'll be 25 hours, and I want to see if this actually works. So we went to a fancy steakhouse. This was in Newport Beach. And when we walked in, I said to the chef, or the waiter, can you just make me like an omelet, and I'll have that with the rest of my dinner. He said, sure, we can do that. So I ate an omelet, a 3-egg omelet. And I didn't get a red face, and I didn't get a stomachache. And that's 23 years ago, and I've been eating eggs ever since, and I eat eggs almost every day, at least 4 or 5 times a week, and I get no reaction. Now that sold me. That was like, holy smokes, this is really amazing. So I came home. I had been working with a patient who had, in a wheelchair, wasn't able to use one leg at all, had no sensation in her feet. She had the use of one arm. She had been diagnosed with multiple sclerosis, and I had been working with her for some months because I thought that she was actually just had a very high toxin load. She had grown up in England, and the farm that she grew up on was right next to a pesticide manufacturing factory, and I was detecting that there were a lot of pesticides in her body, and I thought that these had traumatized her nervous system and caused all this paralysis. Honestly, the treatments that I was doing with her were not doing very much. I was very frustrated. So when she came back in the next day, which is right when I got home from Newport, from the course, I said to her, I've got a new treatment. I want to try it on you. Let's see what happens. She said, sure. Now there's a way that this is done, but the first thing that you check the person for is calcium, and she showed a reaction to calcium. So I had her hold a vial that had calcium in it, and I did the treatment on her, which was you use a vibrator on certain acupuncture points on the body. And there's certain breathing that the person does at the same time. So the first thing that you do is you go down both sides of the spine, and you do it 3 times with the vibrator and with her breathing a certain way, and she's just holding a vial in her hand. On the second time through, now she's sitting in a wheelchair and she's just leaning forward, and I'm leaning over her and I'm doing these treatments. At the time it was an activator, a chiropractic activator. So you punch it, punch it, punch it, punch it, you use your thumb, and the thing goes boom, 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 boom. Doesn't hurt. About halfway through, she leans over her body with her one arm that she could use, reaches under her leg, and starts to scream. Scared me to death. I said, what's wrong? She said, it feels like I've got a hot poker going through my leg. Now what you're supposed to do if you get a reaction like this, I've never seen a reaction like this in my life since my first patient, remember? Is you're supposed to keep going. Because if something turned on a reaction, if you keep doing it, the reaction will eventually turn off. And that's what happened. It took 45 minutes. I couldn't even push the thing with my thumb anymore. I was holding it with the other hand. I was going like this, and then I was using my body because my thumbs were both burned out. All of a sudden, she leans back in the chair. She's in a sweat. I'm in a sweat. I said, holy cow. I said, I want you to call me tomorrow. Let me know you're okay. Now, she was living in a board and care facility. She had no telephone. And we couldn't reach her the next day. She didn't call. We couldn't reach her the next day. She didn't call. 6 days, we didn't reach her. On the 7th day, she shows up at the office. I said, I'm worried sick about you. Where have you been? Why haven't you called? I was really concerned. She says, well, it's really weird. It was really weird, and it scared me, and I didn't know what to do about it, so I just decided to stay home. Okay, so what happened? She says, well, the next day, I'm in the wheelchair. I'm in the shower. Okay, and the pavement in the shower was kind of roughed up so the wheelchairs didn't slip. So it's cement, and it was kind of, gritty. And she said, my foot, with no sensation, is sitting on the thing. And she says, I feel like I can feel something. Like something changed. And over the week, she started to get movement back in her foot and sensation back in her foot. And I had her come back. She was still sensitive to the calcium. I redid the treatment. This time it took 5 minutes. No big reaction. In 3 weeks, this woman was up walking with a cane. She did 15 steps in the office. She said, I got to show you something. She comes in the wheelchair. She pushes herself out of the wheelchair. She's got a cane. And in the hallway of our office, I see her take 15 steps. Then she's tired. We put the wheelchair back. By a couple of months, she was actually able to, with a cane, leave her facility, get on a bus, go. She got a job as a transcriptionist. She could use both hands, and she just got better and better and better. Now that's a miracle. It's impossible. If you're in medicine or if you're a neurologist, it's impossible. I know it's impossible, but I saw it and we documented it, and I've seen reactions like that occur many, 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 many times from doing this very simple treatment. So if you go online, it's naet.com. We abbreviate it to aet.com. Dr. Nambudripad would do a lot of psychological treatments with this. We don't believe that's good or that works, so we do purely a physical treatment on foods and infections and substances, and it's amazing therapy. So if you got ordered AET, usually what it is we will test you for allergy or sensitivity on 15 different things. These are common things, amino acids and iron and minerals and B vitamins. And it's surprising how many times people are sensitive to these things and they have no idea. But it's in a food or it's in a supplement and they get a reaction. And these things aren't poisons. You shouldn't be reacting to B vitamins or to iron or to calcium. And it shouldn't be causing a reaction in your body, but sometimes that's what happens. And these things are largely correctable with this treatment, and the treatment is really good. So that's an overview of AET, and it's really good, and it will help you, and I hope this helps.